So, education of patients regarding OTC drug. What is OTC drug? Over the counter drug. So, every country has a rule. In US it is Food, Drug and Cosmetic Act. In India it is Drug and Cosmetic Act and Drug and Cosmetic Rules. So, there are certain schedule. So, certain drugs are enlisted in certain schedule. So, there is the schedule H. দেখেছিস কোনদিন স্ক্রিপ্টের লাল রঙের লেখা থাকে শিডিউল এইচ ড্রাগ এর তোর নাম কি হ্যাঁ আদিত্য তোর হ্যাঁ অরুণব ওই সামনে এসে বস হ্যাঁ এসছি অনুষ্কা এসছে So, sale of drug is being governed by certain sets of rule. In US it is US Food, Drug and Cosmetic Act, and for India it is Drug and Cosmetic Act, Drug and Cosmetic Rule. There are two things. So, there are certain schedule A, B, C, D. So, governing the licensing and sale of drugs. So, among them there is schedule H drug. The strip contains something written in the red, schedule H. So, this schedule H drug should be sold under prescription. It cannot be sold just like that. Though in India everything is sold in pharmacy without any prescription and without any proper referral to doctors. Alright. And there is schedule X. So, these are restricted drugs, should be sold under prescription. But there are certain drugs that can be sold over the counter. That is a over the counter drug. So, why are certain drugs scheduled in sold under prescription and other are over the counter drug? So, first the over the counter drug concept started in US. So, it was postulated that drugs that does not causes habituation, drugs that are drugs that causes habituation, drugs that needs inspection and guidance by a practitioner, that is the drugs that has very low range of therapeutic windows, and drugs that have recently been approved, new drugs. So, these drugs cannot be classified as over the counter drug. So, one example of drug having very low therapeutic window. Anyone? Hey. Warfarin. ঠিক আছে Warfarin. So, that needs regular supervision by a licensed practitioner. তুই কে তোর নাম কি তুই কোনোদিন এসেছিলি মনে পড়ছে না So, that need supervision by a registered practitioner. Achha. So, which drugs can be given over the counter? So, first of all, the drug must be safe, the drug must be efficacious, alright, and condition which patient can diagnose themselves, and the patient can also decipher the instruction given to them. So, let us suppose you are a doctor who is going to educate the patient regarding OTC drug, over the counter drug. So, first thing, those conditions that can be adequately diagnosed by patient. Suppose fever, viral fever, ordinary viral fever, alright, osteoarthritis of knee joint, low back pain, allergic rhinitis, a running nose. So these can be diagnosed by patient themselves. So drug related to these conditions can be classified as over the counter drug. Secondly, the drug must be safe, that is the therapeutic window must be wide. So what is therapeutic window? বলো, অনুষ্কা বল। অনুষ্কা পড়ছে না, কে বলবে? এনিওয়ান? নো ওয়ান, ঠিক আছে, পড়ে নেবে, ঠিক আছে। So having the drug that is safe, that is wide therapeutic window, মানে সহজে খেলে খুব একটা কিছু অসুবিধা হবে না, ঠিক আছে। লাইক এই ও যেটা বললো প্যারাসিটামল, প্যারাসিটামল ইজ a very safe drug, ঠিক আছে, that can be used as OTC. Then the drug must be efficacious. Whatever condition it is used, it may be it causes good efficacy. What is efficacy? কে বলবে? তুই বল, তুই বল। ও মাসে একবার করে আসে, এইরকম ভাবে পড়লে কিন্তু দুঃখ আছে, ঠিক আছে। Then there must be adequate information either by labeling, drug labeling, or by package inserts. এই তোর নাম কি? তুই কোনোদিন এসেছিলি? হ্যাঁ, কোনোদিন দেখিনি তোকে। আমার ক্লাসে এসেছিলি কোনোদিন? এইখানে এসে বস। So these are criteria for a drug to be over the counter drug, ঠিক আছে। ওভার দি কাউন্টার ড্রাগ কিন্তু শর্টট আসে, গেট ইট প্রিপেয়ার্ড, ঠিক আছে। So why should a patient learn about over the counter drug? Firstly, safe management of diseases. Then over the counter drug should not be used for deterioration of conditions, ঠিক আছে। And thirdly, every drug has adverse effect. So to make the process safe and to make the process free of adverse effect, ঠিক আছে। So first step in over the counter drug is adequate diagnosis, ঠিক আছে। patient must be knowledgeable enough to have adequate diagnosis, ঠিক আছে। So drawback to the process, now let's say fever, patient is having fever, so it may be a viral disease, such influenza virus, fever caused by influenza virus. So you can give paracetamol, ঠিক আছে। Patient can himself take paracetamol. Paracetamol is a safe drug, over the counter drug, patient can take paracetamol. But what is the problem with it? Other condition also manifest as fever. Suppose there is a malaria or a dengue infection, ঠিক আছে, or some leukemia, that will also manifest as fever. Now in case of leukemia or in dengue or in malaria, you need some urgent intervention, alright. So that patient must be adequately knowledgeable to diagnose the disease properly, that is the first step. Then patient must be able to decipher whatever instruction is given in the labeling or in the package insert. The package insert dekhechiস? Have you seen package insert? সব চুপ কেন? আদিত্য, have you seen package inserts? Huh? Package, small chits within the packaging of the medicines. So that is package insert. ठीक है? So instruction will be given within the package insert. What instruction? Dose of medication, number of dose to be taken, number of days to be taken, any relationship with meal, alright, that will be given in package insert. Which route has to be taken? Usually it is taken by oral route. Maybe some other route may be required. So that is written in package insert. So paracetamol, suppose 1 gram, thrice daily for 3 days. Alright. So patient must able to read it out and decipher it. Not that he is taking as many paracetamol as he wishes to. So he or she must be able to decipher it. So the package insert can be made more user friendly by some diagram. This at this time you are taking it orally. Alright. It can be written in the local language, suppose sold in Bolpur. So it can be written in Bengali so that most patient can understand what is there, how the has to be taken. So secondly, patient must be able to decipher what is there in the, what is written in the drug label or in the package inserts. আদিত্য, বুঝতে পারছিস? कहाँ का हो? हरियाणा है. अच्छा. Then the drug must be safe, efficacious. Alright. So there are multiple choices. Suppose if there is fever, there is aspirin, there is NSAIDs, there is paracetamol. ঠিক আছে? But patient must choose what is the can bring the best outcome. Suppose aspirin can lead to bleeding tendency if there is dengue fever. Alright. So patient must choose what is best. So that's why education, imparting the education to the patient is important. Now drawback to this process. First drawback, কে বলবে? তো বললাম তো, wrong diagnosis. ठीक है? Short therapeutic window তো OTC তে আসবেই না. If a medicine has short therapeutic window, it won't come in under OTC. সেগুলো আমি তো বললাম, প্রথমেই তো বললাম যে nothing is obeyed out here, but they should not be sold in the market like that without prescription. Alright. So the first and foremost drawback is wrong diagnosis. Patient may have wrong diagnosis. Then dosage, delayed treatment. Alright. Patient may be suffering from malaria. He is thinking that he is having just a viral fever. Alright. So he is taking paracetamol, but his condition is deteriorating. So delayed treatment, what she has told. Then overuse or underuse of medication. Suppose the patient is having osteoarthritis. Alright. So he is continuing with NSAIDs. So what are the effect, long term effect of NSAIDs? কে বলবে? পেপটিক আলসার, তোর নাম কি জানো? দিশা, what Disha said, that is right, peptic ulcer, and আর কি হতে পারে? There may be renal problem, ঠিক আছে? So there may be misuse of medication, overuse of medication, ঠিক আছে? And there may drug interaction. Alright, the patient may not be knowledgeable enough to know what is the, whether it's a drug interaction or some ADR. There may also be ADR. ঠিক আছে? These are the drawbacks of OC, over the counter drug. There may be something, the condition of patient may deteriorate further. So education must be there, when to stop and where to stop. Alright, so if you are a doctor, you are educating a patient regarding the OTC drug, you must tell that give paracetamol for 3 days or 2 days. If the temperature does not subside, then please come to the clinic for further evaluation. Whatever be that, you may do a test for the platelet to check whether the platelet count is okay. You may do a ELISA test for the dengue. You may check the slides for malaria. Alright, you may do a differential count or total count if there is any leukemia. Alright, so you, when to stop, that must be known to the patient. So that is the importance of educating the patient regarding OTC drug. So what are the advantage of having OTC drug? Why is OTC drug present? So greater access to medical treatment. Suppose the patient is in a far-flung village where there is no access to any health centers or any doctors, and patient is having pain or fever, so, or in the middle of the night where the doctors cannot be accessed. So at that point, patient can have relief from that conditions. That is the plus point of having over the counter drug. Secondly, patient, suppose there is viral fever, by having medication you are going to be okay. So viral disease are mostly, you don't need, most viral disease don't need any treatment. Alright, so by simply symptomatic treatment you can be okay. So in that case, the patient is saving on saving in their money. So they don't need to get visit to a doctor. So they are saving the money. Alright. Number 3, the patient will be having more knowledge regarding the disease as well as the medication. So you are going, whoever the patient is, he is going to have, fever, we can give paracetamol. That is being taught. Alright, having the knowledge that we are such disease have such treatment. Limitations, wrong diagnosis, overuse or underuse, deterioration of conditions. Some example of over the counter drug, ranitidine, কি বলছিস? অ্যাসিক্লোফেন কি? ibuprofen is over the counter drug, ঠিক আছে, diclofenac I have to check, cimetidine is over the counter drug, ঠিক আছে, ranitidine is over the counter drug, OCPs are over the counter drug, pantoprazole I don't think so, famotidine is over the counter drug, huh? Hey, digoxin require, do you know what is the indication of digoxin? Huh? I don't say whatever you feel like. In the examination, if you start digoxin, the examiner will continue with digoxin. Digoxin is a very big drug. Low therapeutic index. I am not asking about low therapeutic index. All right. So these are certain example of over the counter drug. ঠিক আছে, এই শর্ট নোট আসলে পারা যাবে ওভার দি কাউন্টার ড্রাগ? বল আরসি, বল কি কি লিখবি? আদিত্য বল কি কি লিখবি ওভার দি কাউন্টার ড্রাগ? হ্যাঁ, ডেফিনেশন, ডেফিনেশন ঠিক আছে, কি লিখবি? হোয়াট ইজ দ্য ডেফিনেশন? হ্যাঁ ঠিক আছে, তারপর দেন ফিচার্স, কে বলবে? তুই বল, ফিচার্স বল। হ্যাঁ তুই এটা বল। না ফিচার্স, হোয়াট ইজ দ্য, বললো ফিচার্স অফ ওটিসি ড্রাগ, ঠিক আছে, কি কি ফিচার্স থাকবে? হ্যাঁ, ওয়াইড থেরাপিউটিক ইন্ডেক্স, নন হ্যাবিট ফর্মিং, নন হ্যাবিট ফর্মিং, ঠিক আছে, দে মাস্ট নট বি ড্রাগ অফ অ্যাবিউজ, ঠিক আছে, আর ওয়াইড থেরাপিউটিক ইন্ডেক্স, আর থার্ড পয়েন্ট নিউ ড্রাগ, এনি ড্রাগ উইচ ইজ নিউ, নিউলি অ্যাপ্রুভ, ঠিক আছে, দ্যাট উইল নট কাম আন্ডার OTC drug. So such drugs cannot be OTC drug. ঠিক আছে, তারপর নেক্সট পয়েন্ট, নেক্সট পয়েন্ট কে বলবে? হ্যাঁ বল। না সেটা হলো সেফটি, সেফ ড্রাগ, নন হ্যাবিট ফর্মিং and having wide therapeutic index. These are criteria for a drug to be OTC drug. তারপর অমৃতা বল। হ্যাঁ, ইজিলি অ্যাভেলেবেল তো ওষুধের দোকানে সবাই পাওয়া যায়। হ্যাঁ, হাই এফিকেসি তো হয়, বলো তো। তারপর so next you talk about the advantage of having OTC drugs. ঠিক আছে, অ্যাডভান্টেজেস কি কি? অ্যাডভান্টেজেস অনুষ্কা, advantages of having OTC drugs? Better access of treatment, na stop the patient of taking wrong drug, na better access of prevent overdose na, so better access of treatment, then cost is lower, and then grants patient with more knowledge regarding diseases and treatment. আচ্ছা, এটা হচ্ছে অ্যাডভান্টেজ। ডিসঅ্যাডভান্টেজ, রং ডায়াগনোসিস, দেন হ্যাঁ এক এক করে বল। রং ডায়াগনোসিস একটা হলো, ওভার ইউজ, ঠিক আছে, ড্রাগ ইন্টারাকশনস, ঠিক আছে, হ্যাঁ, ডিলে অফ ট্রিটমেন্ট, কন্ডিশন মে গেট ওয়ার্সেন, ঠিক আছে, হ্যাঁ, habit formation, so habit formation drug would not be classified as OTC drug. All right. আচ্ছা, এগুলো অ্যাডভান্টেজেস এন্ড ডিসঅ্যাডভান্টেজেস. So which patient will be eligible for having OTC drug that can diagnose the condition well, can extract information from the package inserts or from the labeling. ঠিক আছে? So these are patient eligible for using OTC drug. Acha. And so what are the so these are the disadvantage. We know about the disadvantage. So how to counter the disadvantages? There are disadvantages of this OTC drug. So how to counter the disadvantage? So regarding diagnosis, nothing much can be done. All right. So regarding medication, always patient should go for monotherapy. ঠিক আছে? Multiple therapies are there. So patient should go for monotherapy. Should go for the ingredient rather than brand. There are certain brands that are, some OTC drugs are being given advertisement. So patient should not fall for advertisement, rather than they should concentrate on brands. They should concentrate on the ingredient. Then from the package inserts or from the labeling, they should extract what is the dose of the drug, what is the route of administration, duration of administration, any relationship with meal. ঠিক আছে? Like famotidine is ranitidine, famotidine, these are taken in empty stomach in morning. Alright. So that should be extracted from the package inserts, and there may be drug interaction. So if there is doubt to the patient should consult a learned pharmacist. Usually ওষুধের দোকানে সবাই জিজ্ঞাসা করেই খায়, ঠিক আছে? So they should consult the learned pharmacist regarding the dose, the duration. If there is any adverse reaction, they can check out with the pharmacist. এরকম র্যাশ হচ্ছে বা যাই হোক হচ্ছে, সেটা they can confirm with the pharmacist. Alright. And if there is any chance of drug interaction, that can be also be confirmed with pharmacist. So some example of OTC drug: paracetamol or ibuprofen আর ক্রোসিন বলবি না, সে অ্যাসপিরিন, ঠিক আছে? ক্রোসিন গেটস ব্র্যান্ড নেম। আর ভিটামিন ট্যাবলেটস আর না, অ্যালকাসলটা যাই না, অ্যাজিথ্রোমাইসিন ইজ দ্য শিডিউল এইচ ড্রাগ। আর হ্যাঁ, অ্যান্টাসিড লাইক র্যানিটিডিন, ঠিক আছে? ফ্যামোটিডিন। হ্যাঁ, পেইনকিলার কোন পেইনকিলার? ibuprofen is characterized as OTC drug. All right. So this is in short about over the counter drug. Prepare it for short note আসে, ঠিক আছে? Now the second topic of the day is educate patients regarding habit forming drug. আগের দিন হয়েছিল তো ক্লাস রিগার্ডিং ডি-অ্যাডিকশন হয়েছিল তো? অমলব মাথা নাড়ছে। হয়েছিল? তুই ছিলি নাকি? না, বাড়ি গেছিলি? বাড়ি গেছিলি, ঠিক আছে। সো এডুকেটিং পেশেন্ট রিগার্ডিং ডি-অ্যাডিকশন, এই কোয়েশ্চেনটা দেখলাম এবার সাপ্লিতে দিয়েছে, ঠিক আছে? এডুকেশন, কাউন্সেলিং অফ পেশেন্ট while prescribing habit forming drug. So name some habit forming drug. Benzodiazepine and Huh? Morphine, yes, and opioid তো morphine একই হলো, ঠিক আছে, আর codeine, these are opioids. Then হ্যাঁ বুঝতে পারছি না, I don't think so. আর so what are the types of addiction? What is dependency? এই কি হলো অনুষ্কা, what is dependency? No. So dependency, we have to take the drug. All right, it can be physical dependency or psychological dependency. এইগুলো পড়লাম তো সবগুলো লিখে নিয়েছে. So what is physical dependency? বল. Side. So stoppage of drug causes withdrawal symptoms. Achha, and physical dependency, sorry, psychological dependency.
Withdrawal symptoms are mainly psychological.
ঠিক আছে, so there are no withdrawal symptoms basically, ঠিক আছে. So drugs like opioids, benzodiazepine, barbiturates, alcohol, they produce physical, and let's say tea, coffee, all right, nicotine, yes, nicotine. So smoking have some physiological dependence, all right, for your purpose nicotine may go. ঠিক, narcotic তো physical dependency, ঠিক আছে. So these causes tea, coffee, all right, so they are laxative, excessive use of laxative, so these are psychological dependence. So actually the body is not, the physiology of the body is not tuned with the drug, but you are mentally so dependent that you have to take the drug, ঠিক আছে. So morphine and fentanyl, these are not available readily, all right, you need very strong prescription to obtain morphine or fentanyl, ঠিক আছে. So what are the instruction you are going to give to the patient while prescribing a habit forming drug? That is the question that has been asked in the supply examination. So first কি বলবে? First, what the doctor must see in the patient before prescribing a habit forming drug? Mental stability. So the patient must be mentally stable. That must be the first thing the doctor must observe, that this patient is mentally stable and he or she can be given the drug. Then secondly, the patient must be informed that this is a habit forming drug, it is needed for your treatment. That must be informed very well to the patient. Then what must be told to the patient? That this is the dose, this is the duration. Please stick to the dose and to the duration so that chances of habit formation may be minimized, ঠিক আছে, whatever be it. তারপরে then, so other than pharmacological treatment, there are also non-pharmacological treatment, আছে তো. Suppose a patient is suffering from insomnia, ঘুম হচ্ছে না, and he is going on taking benzodiazepines. So benzodiazepine is a habit forming drug that causes dependency. তাহলে we must investigate what is causing his or her insomnia. Suppose the person is a student having exams, repeated exam, he or she may be in stress. ঠিক আছে? So the stress may be cause of insomnia. তাহলে কি বলতে পারি? Non pharmacological treatment. You can go for yoga, you can prescribe him meditation, alright. So lifestyle modification basically, that please undergo yoga class, please undergo meditation class, so that his stress level may reduce. So these are non-pharmacological method of tackling insomnia. So I am giving insomnia as an example. Suppose the patient is habituated to laxative. Other than laxative, he is not able to pass stool. So what can be told? Please take lots of water, lots of fibers. Alright. So diet modification. So that can be done. Then you inform the patient regarding the ill effect of long term use of medications. তাই তো? So diazepines, ill effect of long term use of medication, কে বলবে? তুই বল। Anyone? আরশি? সে তো আমি তো ডিপেন্ডেন্স নিয়েই চলছে, ঠিক আছে? হ্যাঁ বল। ডিজিনেস, ঠিক আছে। আর so there may be sleep distortion, the REM sleep distortion may be there. So after long time the so patient may develop tolerance. Alright. So having medication may no longer produce sleep. You may require more dosage to produce sleep. ঠিক আছে? So then you inform him about the monetary losses. You are going to spend lots of time in lots of money for medication. ঠিক আছে? Then আর কি বলা যেতে পারে to the patient? হ্যাঁ বল। স্লিপ অ্যাপনিয়া তো কেস হয়। হ্যাঁ আর কি বলা যেতে পারে to the patient? Withdrawal symptoms may be seen. ঠিক আছে? আর এনিথিং? অমৃতা কিছু বলতে চাইছে না? So আর কি বলা যেতে পারে? You can inform the patient regarding the rules and regulation. So there is NDPS law. So you can warn the patient that if you go on continuing with such abuse, legal action may be taken against you. That may act as deterrence. And finally, what can you tell the patient? That if you are unable to come out of this addiction, you can join some counseling groups or seek psychiatric support. ঠিক আছে? So these are the points that you must counsel a patient when prescribing habit forming drug. বল এই কোয়েশ্চেনটা আসে, what are the points you are going to counsel the patient regarding, educate the patient regarding during prescription of habit forming drug? বল।